Good afternoon. Uh, I, Dr. Vidhi Tiwari, demonstrator, Index Department of Physiotherapy and Paramedical Sciences. Today's my topic is cryotherapy. Cryotherapy or ice therapy is the application of cold to the body tissue after injury. This practice is as old as medicine itself. Nowadays, local cold application may be applied by the use of various form of ice or frozen gel packs or by evaporation of volatile fluids from the skin. Often skin temperature is reduced to 10 degrees Celsius. Cryotherapy. First, cold modalities range in temperature between 32 degrees Fahrenheit to 65 degrees Fahrenheit. Heat is removed from the body and absorbed by the cold modality. Tissue temperature is lowered. To obtain therapeutic benefits, the skin temperature must be lowered to approx 57 degrees Celsius. Cold therapy applied is though to activate a mechanism used to conserve heat in the body core. The mechanism trigger a series of metabolic and vascular events that produce the beneficial effect of cryotherapy. Can be used during all stages of healing. Cryotherapy. Normal skin temperature is approximately 1 degree Fahrenheit. The deeper the tissue in the body, the higher the temperature. Next, skin is cooler than adipose, which is cooler than muscular tissue. Thermoreceptors in skin are responsive to heat or cold, more to cold than heat. Physical principles. When ice is applied to the skin, heat is conducted from the skin to the ice in order to melt it. To change its state, ice requires considerable energy that is known as latent heat of fusion, a specific amount of energy required to change the solid form of a particular substance into a liquid or the liquid into a gas. This energy is called latent heat and is the energy required to change of a state. Factors affecting heat loss. Temperature changes in the tissue will depend on both the rate and amount of heat energy removed. The cooler the application, the greater the heat loss from the tissue. In general, water-filled tissue such as muscle have a high thermal conductivity compared to fat or skin. Thus, the cooling of deeper tissue depend on the nature of overlying tissue. The amount of energy loss is clearly dependent on length of time of cold application. Larger the area, the more heat energy is lost. Physiological effect of cold application. First, circulatory response. The initial skin reaction to cooling is an attempt to preserve heat. It is accomplished by an initially vasoconstriction. This hemostatic response has the effect of cooling of the body part. After a short period After a short period of time, the duration depends on the area involved. A vasodilatation follows the alternating periods of constriction and dilatation. This reaction of Hunting for a mean point of circulation is called Lewis-Hunting reaction. During the vasodilation, the anteriovenous anastomosis is closed, thus causing an increased blood flow through the capillaries. This is beneficial in the treatment of swelling and tissue damage. Lewis-Hunting reaction. Hunting response, a reflex increase in vasodilatation that occurs in response to cold approximately 15 minutes into the treatment. The initial vasoconstriction is often used to limit the extravasation of blood into the tissue following injuries, example, sports injury. Ice therapy is then usually followed by some form of compression bandage. The alternate period of vasoconstriction and vasodilatation affect the capillary blood flow and it is across the capillary membrane. That tissue fluid can be removed from the area and returned in the systemic circulation. Increase circulation, allow more nutrients and repair substance into the damaged area. Thus, ice therapy is very useful in removing swelling and accelerating tissue repair. Ice cubes massage may be used to accelerate the rate of repair of pressure sores. The reduced metabolic rate of cooled tissue allow cooled muscle to contract many more times before fatigue sets in. On metabolic rate, the principal effect on cooling living tissue will be to reduce its metabolic rate in accordance to Wandsworth law. It is said that the rate of any chemical action that can be affected and decreased by a temperature rise and fall. Metabolism, being a series of chemical reaction, will decrease with the fall of temperature. The actual change in about 1.18 for each 1 degree Celsius. Third, neural response and peripheral nervous system. The skin contains primary thermal receptors. Cold receptors are several times more numerous than warm receptors. The cold receptors respond to cooling by a sustained discharge of impulses, the rate of which increases with further cooling. The rate of conduction of nerve fiber in a mixed motor and sensory peripheral nerve is reduced by cooling. The first fiber affected by gradual cooling are the A fiber, myelinated, and eventually at very low temperatures, the B and C fiber, non-myelinated, are affected. Synaptic transmission can also be delayed. This effect is helpful in treating pain and hypertonicity. Fourth, on motor system, muscle strength is seen to diminish on cooling the limb in water at 10 to 15 degrees Celsius, probably because of its effect on viscosity and metabolic rate. But there are evidence that the strength increase or the original value about an hour or so of after cooling has cased. Excitatory cold mechanism. When cold is applied is an appropriate way on the skin, ice can be used to increase the excitatory bias around the anterior horn cell. Combined with other form of excitation, brushing and tapping, and with the patient volitation, this can often produce contraction of an inhibited muscle only with intact peripheral nerve supply. This effect can be used when muscle are inhibited postoperatively or in the later stage of regeneration of a mixed peripheral nerve. These structures are fairly deep and it would take several minutes to produce a sufficiently low temperature to affect them, as it was clinically demonstrated that the reduction of spasm and spasticity occurs within 30 seconds of ice application. The reaction to cooling can only be at the superficial tissue at the skin. The skin stimulus produced by cold must have an effect on the general level of excitation and inhibition in the region of the anterior horn cells. Once spas and spasticity have been reduced, more long-time treatment is given in order to sustain the condition. In the case of spas, active movements are used to break down the vicious circle of pain spas, more pain, more spasm. With spasticity, the technique will depend upon the preference of the physical therapist. Uses of ice therapy. First, reduce pain. Second, reduce spasticity. Third, reduce muscle spasm. Four, reduce swelling. Fifth, promote repair of the damaged tissue. Six, provide excitatory stimulus to inhibited muscle. Seven, used in strength training. Reduction of pain. Pain reduction is one of the major effects of ice application which has been used for many years. The probable mechanism is that by the stimulation of cold receptors, impulses will be sent back which will pass into the posterior root of the spinal cord. These impulses arriving through large diameter nerve effectively block out any other pain impulses attempting to access the spinal cord. Pain gate theory. This reduces the pain temporarily. For permanent pain relief, positive physiotherapy, strengthening, mobilization has to be given during the period of transient pain relief. Reduction of spasticity. The spasticity is the pathological state of increased muscle tone resulting from damage to the upper motor neuron. The small anterior horn cell from the higher control of extrapyramidal system and fire spontaneously at an increased rate. The net result of this is ultimately to increase tone in the extrafusal muscle fiber when the hypertonic spastic state appears. Spasm is a normal response to injury or pain and is manifested as an increase in muscle tone in a specific area with the apparent aim of limiting movement and further damage. Higher amount of spasm is often exceeding and the sustained contraction of muscle will in turn start to produce pain, often resulting then in more spasm. The mechanism by which cold reduce spasticity and spasm are probably the reduced velocity of nerve conduction, the depressed sensitivity of receptors such as the muscle spindle. Indications. First, acute pain, next, chronic pain, acute swelling, myofascial trigger point, muscle guiding, muscle spasm, acute muscle strain, acute ligament sprain, acute contusion, bursitis, tenosynovitis, tendinitis, delayed onset muscle soreness. Contraindications: impaired circulation, Raynaud's phenomena, peripheral vascular disease, hypersensitivity to cold, skin anesthesia, open wound or skin condition, cold whirlpool and contrast bath, infection. Possible effects are due to the effect of cryotherapy seen are mainly due to first reduction in muscle damage remark, first creatine kinase, lactate dehydrogenase, myoglobin, immune marker, leukocyte and neutrophils. Second, reduced muscle soreness rating. Third, reduced muscle fatigue rating. Techniques of application of cryotherapy. The way which ice is applied will vary according to the required effect. It may be applied in the following way. First, ice towel. Second, ice pack. Third, immersion. Fourth, ice cube massage. Sixth, cold compression unit. 7, ice spray. 7, 8, contrast bath. Time of application of various techniques. The time required for the sequence varies, but several authors indicate cryotherapeutic effect sequence occurs within 5 to 20 minutes. After 12 to 15 minutes, the hunting response is sometimes demonstrated with intense cold 10 degrees Celsius, 50 degrees Fahrenheit. Thus, a minimum of 15 minutes are necessary to achieve extreme analgesic effect. Ice pack, simple cold packs, silica gel packs, endothermic reaction, and chemical cold pack. Ice towel. Wet towel is used. Ice towel need to be replaced after 2 to 3 minutes and total 20 minutes of treatment can be given. Useful in treating muscle and allow movement to be performed. Immersion. Simple immersion or whirlpool immersion. Ice cube massage. Slow circular motion for 5 to 10 minutes. During this time, the patient will feel cold, burning, and then aching sensation before the part become numb. Short stroke should be given. Cold compression unit. Cold water is circulated in a sleeve which is put over the limb and part of it is inflamed at intervals. Cold and ice spray. Ethyl chloride was originally used, but it is highly inflammable and thus poses some risk. Fluoromethane is now used widely as it is non-inflammable. The liquid is sprayed on to the area to be cooled in series of a stroke of about 5 seconds each with a few second interval between it. The nozzle is held at the angle of 45 or right angle from the skin surface. Cryotherapy in sports. Acute phase. In acute phase of injury, either on field or while exercise session, the cryotherapy in form of either direct application of cold packs or cold spray is widely used. Cryotherapy is given for at least 72 hours from injury, but it provides best result within 48 hours of injury or acute condition. Rehabilitative phase. Cryokinetics, cryostretch. Cryokinetics, combination of cold application and active exercise. By cryokinetics, cold decrease pain, which facilitate active exercise, reduce swelling dramatically, promotes healing and return to function. Cryokinetics, disadvantage. Pain during initial session, cold can be messy. Cryokinetics indications, sprain, dynamite treatment, ankle, especially finger, strength training. All exercise should be active, performed by the patient. Exercise must be graded. First, begin with range of motion exercise, progress through increased level of difficulty. Next, full sports activities, final level. Principle of chirokinetic exercise, example, non-weight bearing range of motion, plantar flexion, dorsiflexion, inversion, eversion, circumduction. Cryo stretch for muscle injury. More strain and contusion result in muscle spasm or tightness. Many mild muscle pulls are actually muscle in spasm rather than torn muscle fiber. Reduce spasm with cryo stretch. Rehabilitation goal. Promote healing, aid tissue tone, control pain, reduce spasm, control neural inhibition. Rehabilitation goal. Reset central control through aggressive progressive reorientation of full function, develop muscle strength, promote other phases of rehabilitation. Cryo stretch application parameters. 3 sets, numb with ice, then activity. Activity consists of 2 65-second bursts of exercise with 20-second rest between bursts. A 65-second bout stretch muscle to limit and hold 20 seconds. 3 static stretch interspreads with maximal isometric contraction, hold and relax. Dangers for cryotherapy. Frostbite and nerve supply. Thank you.